Hi, I hope you're having a great day and I hope you staying safe at home. I hope you have a great weekend coming up. Today I want to talk about steroids and what can you do about them, because a lot of people are going through steroids right now at this particular point. And while steroids can be life-saving, they can be absolutely life-saving. In many instances, steroids are actually overused. And in most cases where people need steroids, the side effects are never managed effectively, which can create new problems. Here's all that you need to know about steroids. I've actually made a whole list of them because over the last couple of days, we've been seeing most of our patients suffering from the side effect of steroids. So the side effects of steroids really depend on the dosage that you're taking, for how long you're going to take it, and if you have any pre-existing medical conditions. So for someone with an immune system which is already compromised, taking steroids, you need to be a little bit more careful. What I'm telling you is not a choice that you make whether you should take a steroid or not. That's up to your doctor to decide what you need to take. I'm here to tell you how to manage it better and for you to have awareness and educate yourself on what is going into your system. Every patient has a right to know what is going in your system. Why? So that you can take the recommended actions in case they are causing side effects. So number one, like I said, they can be life-saving. We've seen situations where steroids have saved people's lives. And we've also seen when it's been overused and misused. Okay, the number one thing, a lot of people today post-COVID treatment who have gone through a lot of steroids are complaining about this muscle fatigue, joint pain, muscle tenderness, low-grade fever post-treatment when they're at home in isolation or when they're at home, in recovery mode. If a steroid is tapered off too quickly, if you're put onto a steroid and it's removed abruptly or it's not tapered down, yes, some of the side effects in most cases are extreme muscle fatigue. You will feel like you have no strength to do anything. Dullness, throbbing in your muscles, muscle tenderness, joint pain, maybe a low fever like I said. So don't worry, keep your doctor in the loop. This could be the side effect or the withdrawal symptom of you getting off the steroid. So you see right now, knowing that takes a lot of fear out of you, because a lot of people think that, hey, am I getting cancer? Have I got a bone cancer? These are common queries that are coming in every day with people who are getting off steroids. No, it could just be the withdrawal symptom of getting off steroids. So it must be tapered off in a very, very safe way and in a slow way, which your doctor will decide for you. Coming to my next point, immunity. As you know, a steroid is an immunosuppressant. It works by shutting down your immune system, slowing it down. Okay, which is a good thing in many conditions, autoimmune conditions, when your own immune system is creating a cytokine storm that's attacking your lungs or other tissues in your body. It can be life-saving, like I said, but again, you need to work on boosting your overall immune system through your food, through your sleep, by relaxing, taking care of your stress levels, everything that further compromises your immune system, because that's how a steroid works. So when you're on a steroid, work with your doctor to put you on the right vitamins, the minerals, the right foods, so that you don't have a complete shutdown of your immune system where you now start getting infections all the time. So for example, chemo patients or patients on steroids, their biggest risk is catching infections. And that's why we do away with a raw diet at that point, because you don't want infections from raw food getting into your system. We want to cook the food the right way, stay away from certain foods, and add certain foods that can actually help you with your immunity or keep you safe from infections, because your first and last line of defense in the human body, which is your immune system, is now compromised. Now, very important, if your doctor is putting you on a steroid and you are taking non-steroidal, painkillers, inflammatory painkillers like ibuprofens, aspirins, normal painkillers that you can buy over the counter, OTC, please understand that you need to tell your doctor about this, because it can cause gastric bleeding, it can cause ulcers. So it's important for your doctor to know that you are taking these painkillers while you're taking steroids, because they don't go hand in hand. And if they do and you have to take it, your doctor will give you antacids or they will give you mucosal gels that can protect your stomach from ulcers. You can also take care of it through your food and lifestyle, but make sure that if you're on steroids, you are not taking this or your doctor is aware, because a lot of people get pain and it's a common thing. It's actually a common thing. People just keep popping painkillers all the time. So if you're on a steroid, you got to be careful of that. The best time to take a steroid, of course, with your doctor's permission, is always after a full meal. Make sure you eat a whole meal and you take it. You want to line your stomach. You want to line your stomach so that you don't have the side effects of the steroid destroying your mucosal linings and leading to ulcers. Sometimes your doctor will prescribe an antacid with the steroid. Take it, because steroids can create acidity. And as you start taking it, if you can use natural foods, your fruits, your vegetables, your certain spices like ajwain, jeera, fennel, soft, all of that stuff, and manage the acidity naturally, then you don't need the antacid. So it's always better to try to manage the acidity naturally and not get into a phenomenon when you're constantly popping antacids like candy. Take it when you need it. When you initially start steroids, I would recommend take the antacid. And then slowly, as you see that, hey, I'm not getting acidic because I'm eating well, I'm looking after my lifestyle, you can stop the antacids completely. You need to understand that steroids lead to bone thinning. So osteopenia, osteoporosis, we know this is a side effect of steroids. So work with your doctors to make sure that, if you are a bone patient, you've done your bone density tests, or you're taking calcium, you're taking vitamin D3. If you're highly acidic, you want to sort out your acidity problem, because acidity also leads to bone thinning. So you want to make sure that you're changing your overall lifestyle if you're on steroids, which is why it's so important that when you're put on a medication, you need to make lifestyle changes. The way you exercise, your sleep, your emotional wellness, your nutrition, extremely important. So while the steroids could be protecting you, it's causing a problem somewhere else. But if you work with your doctors and your professionals to kind of negate those side effects, it can be managed beautifully. Everyone on steroids don't get osteoporosis. Everyone on steroids don't get osteopenia, because they're trying to manage the side effects by doing the right things. Your gut health. Steroids can create inflammation in your gut. That's why when you start taking steroids, you may get bloating, acidity, sometimes constipation, sometimes loose motions. So again, work with your food, work with your lifestyle to improve your gut health. Now, if you are smoking and consuming alcohol when you're on a steroid, you're doing more damage. Understand that. I understand it's difficult for you to give up smoking. I understand it's difficult for you to give up alcohol, but please understand that when you're on steroids for that period of time, stop smoking and stop drinking alcohol. It is extremely important for you to understand that you can negate the effects of the steroid to some degree if you stop smoking and you stop drinking alcohol at that particular point. Weight-bearing exercise is extremely important, okay? Mainly because of the bone thinning. What are some examples of weight-bearing exercises? Something as simple as yoga, walking, lifting weights, lifting your own body weight. So that's very important for you to engage in weight-bearing exercises while you're on steroids. A lot of people tend to put on fat because and put on weight. Don't confuse it. Sometimes your overall weight gain could just be water retention, because you tend to retain water when you're on steroids. Sometimes it can be fat because steroids affect your metabolism, your metabolic rate. It affects the way fat distributes itself into your tissues and cells. So watching your diet, not consuming excess calories, doing away with junk and processed foods, making sure you find a balance between your exercise and your calorie intake, you can manage your weight beautifully. And remember, if you're in a high dosage of steroids and you do put on weight, just remember, as your doctor tapers you off those steroids, because you can't be on continuous steroids for a lifetime, the weight will also come down. So don't be in fear and don't create more stress, which more stress creates more fat gain. So then you're in a vicious cycle. Take it easy. Know that as you get off your steroids, you can get back in shape. Water retention. Be very careful. Watch. Your ankles swell up. Your fingers tend to swell up. Your face swells up. You're retaining water. Keep your doctor in the loop. And your doctor may put you on a diuretic, or you may do natural diuretics like coriander seeds, barley water. I don't know. It depends on you whether you have a kidney problem or not. So there are natural diuretics and there are diuretics that your doctor will give you in case you have water retention, which is common when you're on a steroid. When is the best time to take your steroids? Preferably in the morning. Preferably in the morning, because unfortunately, if you take it at night or you have to, it can keep you awake. It can make you insomniac for a while. And we know that sleep is a powerful medicine. So work with your doctors to plan your dosage in the earlier parts of the day so it doesn't affect your sleep. Sometimes steroids can lead to mood changes. Okay, it can lead to a fluctuation, a slight drop in your progesterone, a little more in testosterone, different for everyone. So you could have mood swings. Don't get worried about it. Know that it could be because of the steroid and just do your best. Of course, blood pressure can go up. Your blood sugar levels can increase. So work with your doctors to control your blood sugar levels and your blood pressure, even if it's another medication or it's an increase in medication, to balance your BP and balance your blood sugar level. When you're on a steroid and your BP and your blood sugar levels are out of place, now's not the time to try to be all natural and try to control it. Because if you do not control it naturally, high BP can damage you. Your heart, your arteries, your kidney, and you don't want that damage. So take the BP medication with a vision that, hey, I'm going to get off it, but I need it right now. I'm using it as a crutch. Yeah, I need to take my diabetic medication because I do not want uncontrolled blood sugar levels damaging my vessels, damaging my kidney, and creating more problems. So use the medicine as a crutch, work with your doctors to taper off it as the steroids decrease. Sometimes it can affect your eyes as well. So keep your doctor in the loop if you get symptoms of extreme fatigue in the eyes or muscle tension in the eyes. If you are a heart patient and after prolonged use of steroids, you want to get your 2D echo done, you want to get your stress test done. Very, very important. Long-term use of steroids, you want to keep checking your heart at least once a year or more if your cardiologist tells you to do that. Now, the most important part, every medication depletes some vitamins or minerals. When it comes to steroids, you deplete by affecting the absorption of calcium, potassium, sodium, protein. You may be taking protein, but you're not breaking it down and absorbing it. Vitamin A, vitamin D, vitamin C. And that's why some of these vitamins, when they're deficient in you, your appetite increases. Something that a lot of people on steroids say, I'm hungry all the time. You will be. You can eat, but eat mindfully. Don't overeat. Magnesium is depleted, folic acid is depleted, selenium, and certain B vitamins. Chromium is also depleted, which is why science is now seeing that the depletion of chromium is leading to the blood sugar levels rising, because chromium is required to control your blood sugar levels. So all of these vitamins and minerals, don't get overwhelmed. If you're eating a balanced diet, it should be enough for you to replenish all of these vitamins or minerals, or your doctor may put you on a multivitamin, or they may put you on isolated vitamins or minerals as well. So it is extremely important for you that when you're putting something that can cause this muscle damage in your body, don't worry about it. As long as you're managing the side effects and putting in what the steroid is depleting, it's absolutely fine. At the end of the day, you want to get to the root cause of what's causing it, like in autoimmune conditions. Every time you have an autoimmune attack, you're put on a steroid. At some point, you want to find out, what are these triggers? What's causing my immune system to attack my joints, to attack my thyroid, to attack my skin, to attack the myelin sheath? What's causing this? Work with the triggers, you relax the immune system, and you put an autoimmune condition into possible remission. So this is it about steroids. When you look around and see all the steroids being given, don't blame your doctors, okay? The hospitals are full, there are emergency cases. When something's not working, they're gonna put you on a steroid, okay? It's not their fault, they're trying to save your life. Your job is to manage the side effects. Your job is to keep your doctor in the loop about what you're going through and understand that, yes, this is what's happening in my body. This is how I overcome it and protect myself. And once you're off the steroid, clean up your entire system and get back to living an absolutely normal life. Have a great weekend, everyone. Until next time, eat smart, move more, sleep right, and breathe deep. And remember, you care is all about you.